Hey everyone, I'm Juliette.
And I'm Karl,
And this is the VisioNuri podcast,
where we talk all things eyes.
Whether it's eyewear fashion from our collection NURILENS or trending eye health phenomena, we cover some of the things that people might not think about related to their eyes, but should.
We'll explore hot topics in the world of eye health, talk to professionals in the field, and share stories of real people with real life experiences.
We invite you to join us as visionaries looking toward a future with a clear view. Hello, everybody. Welcome to season 2, episode 2 of the VisioNuri podcast. I am Dr. Juliette Nelson, and I'm joined by my co-host, or I'm his co-host, or we're each other's co-hosts.
Okay. I'm Karl.
Yes, Karl. I feel like your introductions are not as good as mine, so I figured since I'm leading out this episode, I show up and show out. Anyway, we also have, and we're so excited because we have our first VisioNuri in the history of VisioNuri podcasts.
Yeah,
Rebecca Mirville, welcome.
Thanks for having me.
So Rebecca, she's a second-year medical student at Meharry Medical College. Did I say it correctly? Meharry Medical College. She holds a BS degree in biochemistry and a master's in health science. Her specialty of interests include ophthalmology and internal medicine. Rebecca was recently selected as a Johnson & Johnson National Medical Fellowship Scholarship recipient, where she will be working on acquiring the skills needed to address and mitigate health inequities that disproportionately affect communities of color. Rebecca is also the co-president of the Meharry Global Health Organization, where she passionately works toward her vision of being able to provide culturally competent and quality care to marginalized groups while volunteering to provide health screenings and basic health education globally. So again, welcome. We are so excited, and we're going to speak a little bit more about her experience when we come back from break with the word from our sponsor. But not only is Rebecca this woman of so many talents, but this is very personal for me because Rebecca and I and Karl, we grew up together. So I am extremely, extremely proud. I think I mentioned on episode 1 that I'm probably going to get like teary-eyed and emotional because I'm so very proud of you, Rebecca, especially the work that you're doing and all of your accomplishments. So kudos to you.
Oh, thank you. I couldn't do it without you guys. So.
Oh, you hear that, Karl?
I think she means we're helping her see. I think it's just the glasses.
No, Juliette, you definitely edited my essays to get into med school. So.
Okay, hey.
Oh, I did. So yeah, I mean, it takes a village. So we're always proud to help and support. Rebecca is also one of our star customers at NURILENS. So she has, as you can see, she's here with her Cairo frames, and she has been a great support. As a matter of fact, last year, she had the opportunity to join us at the National Urban League Black Excellence Marketplace and connect with our customers with us. So Rebecca, I would love to hear from your experience. I know Karl and I, we've been speaking all last season about our amazing experiences, but of course you've been our customer, but you've also gotten a little bit of insight on what it's like to be on the NURILENS side. So we would love to hear about your experience and your insight and your feedback, and even like what you think of your frames.
Okay. First off, my frames are amazing. I always get compliments on them whenever I'm wearing either of my frames. Yay. And so when we were in DC, on the side of NURILENS, it was pretty cool. It was nice explaining to other people like the importance of eye health, and when picking a frame, to pick something that's gonna make a statement, which kind of springs out to your personality.
Right.
So I was also convinced that I should move to DC because there was a lot of Black excellence, a lot of Black professionals with a lot of business. It was really inspiring, and yeah, it was pretty cool.
Yeah,
Hey,
DC's
and I'm
got
happy to
got
hear
a
that.
nice buzz to it. DC's definitely got a nice buzz to it. I understand why Juliette went down there when I went to visit her.
And I would very much understand if you chose to come as well.
Yeah, it's definitely on the list.
Dramatic silence. Dramatic silence. Dun 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 dun. Dun 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 dun. We're gonna work on that, guys. We're gonna work on bringing my boss to the DMV area because Buffalo is too
trying.
cold.
I don't know. We'll see.
Buffalo's too cold. But I'm back to you in the newsroom, Rebecca. No, really, that's great to hear from your perspective. I will say this. We've had, and shout out to all our friends, family, and those who tag along with us to these events, because it can be very nerve-wracking. You know, customers, they do have a lot of questions and so on and so forth. But the nice thing I will say about having Rebecca is because she does have experience even beyond medical school, working in the eye health or eyewear industry. So that was very helpful, because it was nice that, you know, I'm able to talk to one customer, but she's now able to communicate with another customer, and answer their questions, especially on our lenses and so on and so forth. So that was something that I noticed, and that I'm truly grateful for that. But I do also want to ask you about your experiences prior to medical school and what those were like.
Yeah, sure. My most current experience with, at least in ophthalmology, was working as an ophthalmic technician and in Buffalo back in those days, which I don't miss.
Nice.
It was in Buffalo, Ross Eye Institute. Yes, that's where I was working. So,
well, look at that. I'm glad I could bring you guys back together. Okay.
I don't even know how I got the job or why I applied for it, but I wanted to do something in the field while I was waiting to get into med school, and where I landed. And it was such a great experience because I was like, oh, wow, the doctor's work-life balance is so calm and they're making a huge impact. And I was working with a glaucoma specialist as well. So that's where I kind of got introduced to that topic. And I then learned that it was really prominent in our communities. And, you know, we need people to advocate for that, for the health of glaucoma. So yeah, that's my current experience with ophthalmology, at least, or the only experience.
Very nice. So you're saying that, and this is what I'm hearing, that experience is what kind of triggered your interests, your specific interests in the medical field.
Yes.
Now as a med school student. Did
Yes.
you consider any other options?
At first, I thought I was going to be a cardiologist, and who knows? I'm still a medical student, so it's still an opportunity that I might, you know, dive into. That's prescribed for a cardiologist as well. So I guess wherever I go, I'm learning something, and I'm like, wow, this is cool. I'm interested. So you know, as the time goes, I'm like, eventually I'll pick something. But
nice. Okay. Well, we wish you all the best. You know, we're very happy and we're very proud, even more proud that you're working in ophthalmology. Hopefully one day our roads will cross again.
Ophthalmology.
So we're rooting for ophthalmology. We're rooting for ophthalmology, but you know, whatever impact you make in the community, we are excited to see it. And of course, we'll discuss a little bit more about your experience last summer. Because I've got lots of questions, I know. So now we're going to move into Karl's favorite segment, Who's Wearing What? Karl, you always act surprised. I noticed that when I say it's Karl's favorite segment, you know what my favorite segment is.
You say it's my favorite.
So when I say it's your
like
favorite,
everything.
No, this is your second favorite segment.
Oh, okay.
But it's like you get surprised. You know what your favorite segment? I mean, okay. You think you know what your favorite segment is, which is this one, Who's Wearing What? But we know, everybody knows what your favorite is, which is technically mine. So you need to start getting excited.
So
Karl.
we're gonna do the Who's Wearing What segment. This is a segment where we pick a notable figure that everyone knows and we decide what NURILENS frames we think will look best on them. Yes. All right, Juliette. What
we have? Well, in celebration or in recognition of Martin Luther King Jr. Day, which is also recognized in the month of January, We did mention on episode 1 that, we recognized Haitian Independence Day. So right along with that, we have someone who was a huge advocate for the fight for civil rights, Martin Luther King. So that's who we're going to focus on today for our Who's Wearing What segment. Rebecca, since you're our first VisioNuri, we'll let you do the honors of letting us know what you think, which NURILENS frames you think Martin Luther King Jr. could probably be wearing.
Okay. I feel like I could see him in the dark Elwood, the ebony frames.
Okay.
It's giving like old school vibes, but also that's what the glasses, the shape, at least is what smart people used to wear if they were like nerds or like super educated. So that's what it's given to me.
Okay.
I can see that, you know what I'm saying, in his Baptist church or,
Yeah.
a sermon, okay.
I like it. Okay. So the ebony, the Elwood City ebony. Okay. Karl, I feel like since I'm hosting today, the least you can do is go first.
No, you got it. You can go first. You got it.
This is so unfair. Anyway, so
I don't want you to steal my answer.
I, again, in the same spirit of independence, I thought I'd go with the 1804s. I know I chose it for Mbappe. I feel like, Karl, I feel like you chose the 1804s. And now I'm fine with the fact that I went first. But yeah, I mean, our 1804s, they represent independence, they represent the fight for freedom, and so on and so forth. So I think in the same spirit of that, I think given what they mean and what they represent, I would put Martin Luther King in the 1804s.
That's definitely a safe choice.
And the 1804s, I will be very honest, the 1804s, like from its roots, they give me Malcolm X vibes. And that's why I said they very much, to me, give me the freedom vibes. And even though Malcolm X and Martin Luther King Jr., they had different approaches, nevertheless. Look at him trying to change his answer because he knows that's what he chose. Karl, just admit it. That's what you chose. It's okay. Just say it. Just say it. You're struggling to speak. Just say it.
All right. So for this is hard. I also chose the 1804s. My reasoning was better than Juliette's. I think he would have saw Malcolm X, and he was like, you got some nice glasses, but I got 1804s, you know what I'm saying? So mine are a little nicer. So that's kind of my reasoning. I don't know really I'm not typing into the whole independence thing, but
that's the meaning. That was the meaning behind the name of our frames.
No, of course, but that's not the reason Martin chose the 1804s. I think he chose the 1804s because he saw Malcolm in his plastic frames, and he was like, let me one up you with these wooden brow line frames, you know what I'm saying? So that's my
Martin came in peace. You really think he's trying to one up Malcolm?
I mean, that's where he gotta get the edge, you know what I'm saying?
Okay. Look at us imagining Martin Luther King Jr. and Malcolm X in the same room. But Malcolm X wore a similar style, to be fair.
Yeah, he had the brow line frames, right?
It's just he had them. They were in plastic, as you said.
So
okay, so basically, Martin Luther King is showing up and showing out with a pair of wooden Sustainability. He is here protecting the environment. We appreciate you, MLK Jr., especially for the sacrifices that you've made, even to this day. All right, so now we're going to hear a word from our sponsor, and we will be back. This podcast is sponsored by NURILENS, a handcrafted wooden eyewear company. We offer a number of vision and eyewear solutions, whether non-prescription or prescription. NURILENS combines style, performance, and sustainability by creating an experience that encourages self-expression, impact, and improved vision health. Visit www.nurilens.co for more information. Hey everybody, we are back and we are now going to dive right into our topic for the day. As many of you may or may not know, the month of January is dedicated to glaucoma awareness. And that's why we felt it appropriate to have Rebecca as our first VisioNuri, especially discussing her experiences, especially last year. So first, Rebecca, given your experience working even in Buffalo and today, could you give our listeners a little background on what glaucoma is?
Yeah, sure. Well, just a disclaimer, as everybody knows, I'm still a student, but I'm still learning.
Claiming that she a doctor.
So glaucoma is basically disease, an eye disease where the optic nerve, and the optic nerve is it's like a cord that connects the eye to the brain to allow like visual information to be processed, right? So the disease is going to affect the optic nerve where it eventually dies off and affects your vision where you have no vision, vision loss. Well, how that happens is sometimes glaucoma, most times actually, it's associated with high pressure in the eye. And how that happens is there's a fluid in our eyes called aqueous humor, and that's like flowing around, providing nutrients to the eye. And sometimes what happens is that the flow can be obstructed or blocked, and that's going to lead to an elevation of pressure in the eye. And then the fiber surrounding the optic nerve is going to, impinge on the eye, the optic nerve, and eventually it's going to, cause that vision loss. But it's not always a case where glaucoma is caused by high pressure. There could be other causes as well that we're not really too sure about. And yeah, that's pretty much it for glaucoma, how you would treat it. The thing about glaucoma is treatment works best during an early detection. Because right now, there's no way to restore vision. We're still working on, but that's gonna take some time, of course. So early detection. What else do I have to say about it? Oh, that's another thing. There's a lot of risk factors for glaucoma, including age, and unfortunately, race and genetics. So glaucoma there's a high prominence of glaucoma in African Americans and Latino communities. I feel like there's a lot of risk factors that contribute to that, including like socioeconomic factors, especially since glaucoma can be treated early on. So if you're catching it really late because of those socioeconomic factors, then, there's not much we could do. But that's essentially what glaucoma is. And
so let me ask you this though, is it something that naturally happens, or are there genetic or I don't know the proper term, but like factors in our anatomy that make us more prone?
Right. There's so many things. Yeah. Definitely genetics. If like my grandpa has glaucoma, which is why I'm really interested in it, that increases my risk and my family's risk of having glaucoma as well. Trauma can be a factor of glaucoma, like eye trauma. That's all I know of so far, but there are a whole bunch of other factors, including like there could be vitamin deficiencies, there are a whole bunch of factors.
Interesting. Okay. So you did share with us that you were a Wilmer Eye Institute Summer Diversity Scholar at Johns Hopkins University, which is huge. And I know you did that last year. So could you share with us a little bit of your experience, what you did there? And you did some research on glaucoma as well. So would you be able to share with us what your experience was like and what your role was as a scholar there?
Okay, yeah. So first of all, it was a huge blessing that I got into the program. Yeah, it's like dreams, goals and everything. So there was about 10 scholars, I would say, and I was one of them. And some of us were in Baltimore. On a day-to-day activity wise, Monday, Wednesdays, and Fridays, I would be shadowing my mentor. And he's like a glaucoma OG. He knows everything about glaucoma, has been there for a long time. And his name is Dr. Quigley. So I would shadow him on his appointments. We would go to journal clubs where we would like discuss a prominent topic in glaucoma or ophthalmology in general. And then I would spend the rest of my like long hours working on my project, which is focused on glaucoma, basically developing a biomarker for glaucoma. And then on Tuesdays, what Tuesdays and Thursdays. Thursdays we had grand rounds, which is when all the residents, the attendings, all the directors, they all meet to like have like a kind of like an educational discussion about any rare cases going on in the hospital or in the institution, just to stay informed about rare cases. What else we do? And Thursday is my favorite day, actually. I got to sit in and scrub in for a whole bunch of different surgeries. So it was inspirational to see that, you know, that could be me one day kind of thing. So that's what I do on Thursdays. On the weekends, I was just I was in fellowship with the other scholars. So people who I'll be applying to residency with. So kind of like we keep in touch to like keep each other informed about opportunities and our other projects as well. So yeah, that's what I did while I was there. And the project is a whole other topic conversation.
Okay. So you said they were looking for like biomarkers for glaucoma. Like, I mean, like what type of biomarkers?
Okay, so that kind of goes into what I was doing for my project, which was let's see. So I came in working on a project that was building upon another project. So the prior project that they were studying and found, it was actually, well, let me start with the title of the paper that we wrote, which is called Optical Coherence Tomography Measures Lamina Curbosa Strain with Intraocular Pressure Change as a Biomarker for Glaucoma Damage. So that's a mouthful, and I'll just break it down. So basically, we studied how pressure can affect the strain of a structure in the eye, which is called the lamina curbosa. And that's basically a support system for the optic nerve head, right, which we talked about earlier. And we want to see how the strain changes according to pressure change, right?
Okay.
Yeah. So the previous papers were talking about, okay, you have a patient, right, who has high pressures through the roof. We want to see what the strain looks like before the pressures are decreased and after the pressures are decreased. So they would decrease the pressure by surgery or giving them eye drops and take pictures before and after to see what the strain looks like. So essentially, if somebody who has like severe glaucoma damage, we would see a certain type of strain pattern, which will help us understand glaucoma more. So if a patient comes in is like, okay, let's see where they are in that glaucoma scale. We can kind of compare and contrast those findings. My specific project, we were looking at kind of like the opposite effect. We want to make sure that data correlates all together, makes sense. So we put goggles on their eyes, swimmer goggles, and we took out the lens and we took pictures before and after the goggles on for 20 minutes. So we wanted to increase the pressure and see what that strain looks like. Does it look like what it was when they had high pressure kind of thing? So me specifically, I took all the images and I like manually marked all the structures behind the eye.
Okay.
So we could see before and after. And then we ran it through some software programs. And from there, we did analysis. And result-wise, I'm not going to go into it because there are a lot of interpretations from the papers. But essentially, we just want to see if we can have data that makes sense so we can start helping patients understand what their glaucoma damage looks like.
Okay, so essentially using like the OCT as an avenue to help let patients know beforehand.
What's an OCT?
As the ocular coherence tomography that she was talking about. It's the scan, the picture that they get of the eye. So yeah, okay. That makes a lot of sense. That's cool. That's awesome, actually.
It's really cool. When I first got there, I was like, I have no idea what I'm doing. But day by day, I was like, oh, okay, this makes sense. This is nice. So yeah, I hope that makes sense.
So with some of the, I'm curious about some of the surgeries that you shadowed. Is that the proper terminology?
Yeah.
Was this solely for glaucoma patients or was it for others as well?
A lot of it was cataract surgeries, which was cool because that's something that I definitely would want to do in the future. Right. Cataract, and then there was like a glaucoma stent where they put like basically they try to find a way for the flow to incorporate it back. Yeah. What else did I see? I have names of everything. those are two major ones. We saw a rare case where somebody's cornea was burnt off.
Cornea transplants?
Huh?
Any
Yeah,
cornea
yeah, I saw a cornea transplant. Yeah, there was a specific name for it though, because it was like a rare.
Wait, their cornea was burnt off?
Yeah, it was like something happened to their cornea. I know I should have read on this. I have notes on it actually, but it was a young child. It was such a weird case.
My
Rare
goodness.
case. Yeah, a rare child. They had some genetic factor, I believe,
Okay.
and they were doing a corneal transplant. It was interesting.
Wow.
It's really weird to see them do surgery on like a small organ.
Yeah.
Right.
And like most of the surgeries, they're like the patients are awake and aware, but it's just really cool.
Mhm.
And it's like 30-minute surgeries. And also,
so they're very short.
Really short. The corneal transplant one was a longer one because that's a rare case, but the other surgeries are really, really short.
It's amazing how many surgeries you can see like a surgeon doing a day. Like they just line them up and they
were
in and out,
playing music, chilling.
They're listening to music. Meanwhile, everyone else is tense, but they're good. It's like, yeah, it's just another cataract surgery. But, yeah.
Well, I mean, they put in their time, so I could imagine that eventually it's something that, it's not something that becomes tense for them. They just do it. They go on autopilot and they do it.
Yeah.
So I know you did mention, the disparities, right? Especially in Black communities. And that's one of our focuses as well, looking at how we can increase awareness for Black, especially Afro-Caribbean communities, communities of color as it relates to eye health. Did you make any observations in your research on the differences of how glaucoma might impact Black and Latino individuals versus other races?
Yeah, that was one of the things I pointed out earlier. It was like when we find the progression of glaucoma in other patients, African American and Latino community people.
Right.
So it's like, because glaucoma, essentially the damage is so like, it's not really something that you will notice until it's so severe.
Okay.
So most of the African American patients that I would see is already like, the image is already there kind of thing versus early detection kind of thing. So there was also another time where a Haitian patient came in and I was like, ooh, let me go ahead and translate. I couldn't translate because there's like regulations on like, you have to call a line. But that's one of my goals where I want to make sure I'm trained in medical translating, because it just seems it makes more sense to like connect to a patient.
Yeah. It's more personable.
More personal.
Yeah.
So let's see. Yeah, that was
so and you make a great point. You have your Black and Latino patients who come in where like glaucoma has progressed significantly. I'm also assuming you've seen patients of other races, right? So based on your observation, did you notice that they were coming when there was like a little bit of an earlier onset of their glaucoma versus, the others?
Yeah, it'd be like most of the other cases that were found is because they do regular screenings every year kind of thing. Versus I noticed a change, that something wrong, or something like that. Or somebody told me something was wrong, so I came here. Versus like, oh, we incidentally found damage or glaucoma risk. So those are the differences that I've seen.
Yeah, and to touch on something, that she was saying, like even working at Ross Eye, they have an office downtown Buffalo, but they also have an office in like Orchard Park, which is a predominantly wealthier area. So like you'll notice, right, like whenever I would be working downtown in Buffalo, you'll see all these Black patients, they come in and it's like, they don't even really know what's going on. They haven't been seen, you check the chart, they haven't been seen in 5-6 years. Their vision's just a lot blurrier. And then it's like, oh, you have glaucoma, and it's severe at that point. Whereas in comparison, like you were saying, in Orchard Park, they're regularly checked. So it's earlier on, and then there's a lot more they can do to help prevent it worsening for them. So it's unfortunate, but.
So let me ask, and I'm going to ask this question to both of you because in some way, shape, or form, you both touch ophthalmology. For Black and Latino communities, what are the limitations? What are those specific, whether it's socioeconomic or whatever, that's limiting their awareness? Would you, from your experience, from your observation, but what are the resources that you're available of that help them to mitigate them? Because we probably even have listeners who identify as Black or Latino, and they can also, you know, share that information with a family member or loved one or friend. So yeah, what are the limitations you found, and what available resources do you know exist? Perhaps what even recommendations do you hope can evolve in the field to support Black and Latino communities as it relates to glaucoma and other eye health issues?
Okay. Do you want to say anything, Karl?
Well, I mean, Juliette, we always talk about this, about how there's like, how people don't like getting checked out regularly,
That's
right?
right.
And part of that, I think, comes from like a distrust that people have with their
Yes.
practitioner, you know? And I think that can stem from you going to the doctor's office and not seeing anyone that looks like you, right? So that's why we appreciate having like Rebecca on and working to become a doctor, so she can provide representation. So now people feel like, okay, she understands me, she understands my problems, you know, and I trust her more, right? So I think that's a big step towards getting people go to their doctor regularly and get checked out for just to be, you know, ahead of the game, right? So they're not coming in 5 months later down the line when it's too bad to fix. So
right. Those are, I think that's a lot of those are good points. In addition to that, I would say just lack of information. We don't see as much people talking about it. Let's see, what were the other questions that you asked again?
So what are the limitations? Where can they find the available resources? And what recommendations would you have for the practice or the field in the future?
All right. I think I'm gonna start backwards actually and start with the last question that you just mentioned with things that we can have in the future wise. Like some ideas that I have are like, we do this a lot. Growing up in our church, we had a health day, and we'll come in and just talk about whatever health fact that they feel is important to them, kind of thing. And I feel like that's like really important, especially to start in like our communities, like in our churches, and talk to especially the older population, because they're at higher risk for a lot of diseases actually. So like, you know, like having education forums about that. I'm not sure what else, like providing services outside, because there are things that we can do as providers to do early screening as well, provide early screening or free screening at least, be like, oh, check pressure, and be like, your pressure is kind of not normal, out of range for normal. So I would suggest going to see an ophthalmologist.
That's a good point.
But I think another challenge too, and I don't know them, I've never seen an ophthalmologist. I've only gone to my eye doctor, and we've you know, shared on episode 1 how I haven't gone in 2 years. And I'm also guilty. I hate to admit it, but it's out. I'm guilty of not going for 6 years, right? So God forbid I had a similar issue. I wouldn't have known until I went to the optometrist. But I think as well in our communities, when you think eye doctor, all you think of is glasses. And I think, and I'm pretty sure this is in other races as well. There's the perception of I go to the eye doctor. If there's something wrong with my eyes, that means I'm getting older. Now I have to wear glasses, right? So there's this aversion. But I think there's also space for people to understand that the eye doctor is beyond simply just wearing glasses. It's really about your eye health. And you know, if I may add, I think when we're looking at TV and commercials, all of that, to Karl's point, we don't see us, right? And so when you don't even see you may not even think it applies to you, even though it probably needs to apply to you more, especially if you're not going. So it would be very nice to And to your point, Rebecca, having these, I know that's something, as you said, we used to see at church all the time, even though, our parents probably dragged us kicking and screaming. But, now looking back, it's like, wow, this is something really important, right? Making sure that the community is aware of the importance of going to your eye doctor, right? This early detection, if there's something going on with your vision and so on and so forth, if we're able to catch it early, we can actually treat it in the earlier phases instead of when, you're going into visual impairment. So.
And I off of something that you said, because you said you just go to see like the optometrist, right?
Mhm.
I can't tell you how many times I've had someone come into the ophthalmologist and say, I've been going to my optometrist and they never told me I had keratoconus, or they never
Right.
told me I had this like underlying issue. So it's really important to to go into the ophthalmology office and get seen and get checked out. And maybe you go every 2 years, maybe you go,
Right.
like you're young, you want to go every 3 years, but I think it is important to get checked out because there's issues that affect people later in life, and there's issues that affect like teenagers. So
Right.
yeah,
And especially with technology and stuff, it impacts our eyes even more. So yeah, that's a very, and I'm really happy that we had you on here, Rebecca, and I'm very glad that you're even in that field, both of you. I'm such a proud big sister, y'all. I just wanted to share that emotional moment. Fix your face, Karl. Enjoy it. Just bask in the moment. Cringing right now. But no, I'm extremely proud because it's, and we know when being Haitian, what are you going to be? A nurse, a doctor, a lawyer, or an engineer, or a failure, but when you hear the medical field, so I guess I became the failure because I did business and psychology. But
like 8 companies.
but when we think medical, right? At least for myself, and I'm pretty sure others can attest to it, we don't think of those specific minute details, right? That tie us, that bring us into these other fields, such as ophthalmology, right? You think doctor, and especially in our culture, we think diabetes and high blood pressure, right? We don't go into those nitty-gritty details and nuances of health, especially eye health. So it's again, the work that you both do is extremely important, and it's extremely valuable. I do want to ask this, Rebecca, for our listeners, what are some things that they may observe in its earlier stages? I know that you said it doesn't become as evident until it's progressing, but is there anything in the earlier stage that they may notice that's off, that says, okay, I really need to check for an ophthalmologist versus my optometrist?
Yeah, I think that's the tricky part. There really isn't anything that you would have or feel. Sometimes people feel
Oh, wow.
headache pressure or something, but most time it's like, oh, I didn't even know. Wow. Like some people don't even realize, because glaucoma, you start losing vision in your periphery. So like
Okay.
the outer vision basically.
Yeah.
And
Okay.
you might think it's normal until like you do a
Right.
test and it's just like, oh, I can't see on this portion, or so
Right.
they're kind of really a tricky question, because there really isn't anything that could scream, oh, you better go see an ophthalmologist. It's just, that's why there's a early screening is important, or following regularly with the doctors, even if you don't know if anything's wrong. Just
Right.
But on top of that, one thing that might kind of like help you maybe find something early is if like you have other underlying diseases like diabetes or hypertension. You should definitely go and get your eye checked out as well, because those things can be correlated to other eye diseases as well, like diabetic retinopathy or glaucoma too, as an association. So that's the most I would say can help, with wanting to go in early.
Well, I know I'm going to be finding an ophthalmologist. I'm sorry, Karl. You probably, I should have done it a long time ago, just working with you. But
also, if you're highly myopic, like if you have like a intense prescription to see, like you are also at risk for glaucoma or any other eye diseases. So just making sure those those prescriptions are right, and also getting checked is important as well.
I'm pointing at you, Juliette, by the way. Just
mine too.
You don't, first of all, you don't have to expose me on this podcast.
Juliette, this wouldn't be the first time. They already know, okay?
Well, I'm gonna be taking everyone on. We are gonna be taking everyone because you got dry eye. Okay.
Yeah, I'm dealing with some dry eye.
So we're gonna be examples of, you know, going and getting our eyes checked. But I know one thing. I know with like insurance providers, health insurance providers, they say that you're supposed to get a referral and so on and so forth. So I'm hoping, I don't know exactly what the nuances are, right? If going to your ophthalmologist is more considered under health insurance versus your dental and vision care. But if there are complexities to it, hopefully, you know, down the line, people are more able to get access to both their optometrist and their ophthalmologist, because the two need to function together instead of one versus the other. And then I'm going to ask you one last question, Rebecca, and I'll toss it back over to Karl if he has any final questions for you. You know, one thing we emphasize is representation, right? And I'm sure we all identify the same way, Haitian American, you know, so that makes us Black, children of immigrants, Afro-Caribbean, Afro-Latina, and also being African American in this country. So you being in this field, what does the representation mean to you? And yeah, what does it mean to you, especially based on your experience?
It means absolutely everything, honestly. We touched on it earlier as well. Like, it's just more personable when you can relate to the person who's giving you advice or checking on your health. Even being a student, I go to a HBCU, so I'm around other Black and Latino or minority students. So it feels great. But then when we step out to do like research, or when we step out to do our clinical clerkships, we are the minorities again, you know? So it's like, we don't see that, we don't have that as much direction. So it's really important that, you know, we stay motivated to become the change, because it's like one of the biggest ways that we're gonna allow our communities to do better with their health in general. Right. So yeah, it's really important to me. I do, now that I'm in the field, I also can reach out to other minorities who have, you know, basically are successful in their career, and look to them to like advice and everything. So having that for myself kind of shows how we need doctors for other communities, our communities, because yeah.
Karl, do you have any final questions for our first VisioNuri?
I don't have any questions. Just thank you for coming on and talking to us about glaucoma, especially during Glaucoma Awareness Month. I know you definitely have a busy schedule, so thank you for giving us some time. And it was nice speaking to you about the representation and the importance of getting your vision checks regularly.
Yes, doing it for the culture. Yes, absolutely. Thank you so much for having us. Well, for you being had on our podcast.
Maybe this is the last time you leave the podcast, Julia. I'll take over.
I get it though.
Listen, I have other responsibilities. So this was, you're the boss, Karl. I was just following your directives. Clearly performance didn't match up, but I tried my best. Well, let us know what you think of my performance, because I think I did at least a satisfactory job. So
excellent.
And now for the place that I perform and excel in.
All right, I'm ready.
It's our joke of the day.
All right, it's the joke of the day.
Are you both ready?
Okay, wait. Before you go, Rebecca, I need you to honestly let us know if this joke is like horrible, if we need to cut the segment, please. Like, I need honest feedback. Do we cut this segment?
But it's up to the people. And Rebecca is part of the people.
I just want her opinion. Not saying she has, like, not saying we have to cut the segment, but just let me know, please. Like, if it's really that bad, then please. All right, Julia, go ahead.
Are you ready? Okay. What do you call lotion that makes your eyes wet? Karl's not even interested in answering. Moisturizer.
I was like, what?
I got Rebecca to laugh. That was good. Moisturizer. Oh my gosh, that was so good. Oh my gosh. That was good. See?
That was probably one of your better jokes.
Wow. Juliette 1, Karl -2.
That's funny.
That wasn't too bad.
That was great. That was great. That was great. And she laughed. She laughed. When we get our next guest on here, I don't know that our next guest may, or one of our next guests may.
Not gonna let you.
And when you meet them, you'll probably know why. But I'm gonna see if I can convince them to laugh. That wouldn't be fair, but you put me on the spot this time, so I think that
wasn't bad. That wasn't bad.
that was a good one. Anyway, everyone, again, thank you, Rebecca, for coming on and being our guest. We are so thankful and we're grateful again, as Karl said. I echo his sentiments that, we're grateful that you joined us. And I, for one, am extremely, extremely proud of you. And we both look forward to seeing what you do when you graduate and to see how you're going to continue to make an impact and see through the lens of your purpose as you progress throughout medical school. So all the best to you. Hopefully you make it out with your sanity and flying colors, because we know
right,
grad school is not a joke, especially when you're entering into doctorhood. But yes, we do wish you all the best. And that is the conclusion of the VisioNuri episode 2 for our second season. Juliette signing out.
Bye.
Bye.
Thank you again for tuning into the VisioNuri podcast. We hope that you receive some nuggets that will help you make better decisions about your eye health. Anything we've discussed in this episode should not be taken as medical advice. If you have any questions or concerns about your own personal health, please reach out to your doctor.
If you like what you've heard, feel free to leave us a review with your feedback. Also, feel free to visit our website at www.NURILENS.co for your next pair of frames.
We offer non-prescription and prescription options with different features to fit your style and vision needs. Enjoy 20% off your purchase with the code VisioNuri20 today.
Remember to see through the lens of your purpose, and we look forward to chatting with you next time.